Hello and welcome to another TLDR US video. Throughout the Democratic primary, one of the biggest points of debate has been the issue of healthcare. And with phrases like Medicare For All and single payer system being thrown around, we figured it would be a good idea to go over the various plans proposed by Democratic candidates. And our Patreon viewers agreed, voting for it in a recent poll. So here we're going to go through the plans of the major candidates and explain what they mean for America going forward. If you want to have your say in the topics we cover going forward, then be sure to back us on Patreon. You can get your vote for only $3 a month, but higher tiers get other stuff, like free merch, early access to videos, behind the scenes posts, and a credit at the end of every video. Check out what's on offer by clicking the link in the description. Before we get into the plans of the specific candidates, let's look at what Medicare currently is. To start with, Medicare began in the 1960s as part of President Lyndon Johnson's Great Society agenda, in which he greatly expanded social programs including Medicare and Medicaid. Medicare is the national insurance program that's extended to seniors starting at age 65, while Medicaid helps those from the lowest income households. Since then, however, the question of extending health insurance to all Americans has plagued politicians, and this election cycle is no different. Let's start with the most well-known plan, Medicare For All. Essentially, this would remove the age requirement for Medicare. Senators Bernie Sanders and Elizabeth Warren have both been vocal advocates for this plan, arguing that it's the only way to truly fix America's healthcare system. In a nutshell, Medicare For All would end private health insurance and replace it with a government-funded healthcare system. However, this doesn't mean that private health insurance would be illegal. It only means that companies wouldn't be allowed to offer insurance that covers areas already covered by the government. This means that there would still be private insurance allowed in the United States, but not at the level it's at right now. This is similar to systems found in countries like Canada and the United Kingdom, and it's what's known as a single-payer system. In fact, in his original bill, Sanders took great inspiration from Canada's healthcare system, adopting many of its strategies and policies, as well as adding some of his own. If implemented, the Sanders version would provide the most generous government-funded healthcare coverage in the world, with his plan covering everything from open heart surgery to dental work. But with this generosity comes the question of money, and this is where the candidates' differences begin. Because while Sanders and Warren are both advocates for Medicare For All, they have different plans of how they go about paying for it. The economics of Medicare For All are very controversial in the United States, with many claiming that it will cost far more than the government can afford. This isn't a new problem either. Since their inception, Medicare, Medicaid, and other social safety net programs have faced numerous cuts in efforts to balance the national budget and decrease federal spending, which has sparked a seemingly never-ending debate about how to pay for the cost. As such, many argue that it would require raising taxes on the middle class, a situation which nearly everyone, with the exception of Senator Sanders, is opposed to. Warren attempted to solve this problem in late 2019 by releasing a plan that sought to pay for everything solely through taxes on the wealthy and big businesses. Sanders, on the other hand, has declined to release a specific finance plan, but has stated that he would likely have to increase taxes on the middle class. It's worth pointing out that most studies do indicate that the net costs that families would face would go down, with analysis from both the New York Times and NPR suggesting but not confirming this school of thought. The logic is that although taxes might go up, this will be offset with the removal of premiums and other costs of private health insurance. Without getting too technical, private health insurance results in a number of other expenses, such as co-payments, deductibles, and premiums. Essentially, what these are extra price tags on healthcare. So while the taxes may go up, it's likely that it will be balanced out with the decrease in all of these medical costs. As I said, this has been one of the major selling points of Medicare For All. But this has so far gone untested in the United States, and no one technically knows how it will go. Because when it comes to the long-term effects of Medicare For All, no one really knows exactly what will happen. Economists have differing opinions on it, but most agree there are too many levels of uncertainty to know for sure what a single-payer America would look like. The other type of healthcare plan proposed is what's known as a public option, which basically gives government-funded healthcare to those who opt into it. There are several versions of this being proposed, but let's start with former Vice President Joe Biden's. It's no secret that Biden has built much of his campaign on his time in the White House with President Obama, so it comes as a surprise to no one that his healthcare plan is heavily based on the Affordable Care Act, more commonly known as Obamacare. Biden says that he wants to expand Obamacare to include a public option and make healthcare more affordable for average Americans. To do this, he proposes increasing government subsidies, offering tax cuts to middle-class families, and drafting legislation to control big companies involved in healthcare. He also seeks to lower the price of prescription drugs by allowing Americans to buy from foreign markets to increase domestic competition, as well as implementing laws that will prevent drug companies from raising their prices. Mayor Pete Buttigieg has a similar plan, which he refers to as Medicare for All who want it. Buttigieg's plan also promises to give public health care to anyone who enrolls in it, and uses measures similar to Biden's to control drug companies and healthcare prices. The main difference between the two plans is less in the plans themselves and more in the end goals. Biden says he has no intention of ending private health insurance, and while Buttigieg has said the same, he has added a few conditions. Buttigieg always portrays his plan as setting up a natural glide path to Medicare for All, and claims that it would allow people to decide the pace at which private to public transition occurs, or if it occurs at all. Senator Amy Klobuchar's plan is a bit of a mix between Biden's and Buttigieg's. Like Biden, she plans to expand Obamacare and lower prices across the board, but she also plans to implement a public option through Medicare, or a Medicare-like system. Klobuchar has the least developed healthcare plan, and has generally argued for the public option without getting into specific details. In fact, Senator Warren went after her on that exact issue in a recent debate, claiming that Klobuchar's health plan was only 2 paragraphs long. But this doesn't mean that she's got nothing. In both her campaign and her time in the Senate, Klobuchar has focused heavily on reducing prescription drug costs, as well as placing a heavier emphasis on mental health. And while her website is somewhat lacking in specifics, it does lay out a general framework that she would follow. The final major candidate proposing a public option is Michael Bloomberg, but his public option looks quite different from that of Pete Buttigieg and Joe Biden. While Bloomberg does aim to establish a public form of healthcare, his plan is less sweeping in its reforms. Both Biden and Buttigieg have promised to make it free to enter their respective healthcare plans, but Bloomberg has made no such promises, with his campaign website stating that people would still have to buy into his plan. He does share some goals with his fellow candidates though. Like all of the other candidates, Bloomberg promises to reduce prescription drug costs, and put a cap on what hospitals can charge people for. Of course, the big difference between healthcare plans will come in the general election, when the Democratic nominee will face off against Trump and his aims of repealing Obamacare and decreasing government healthcare spending. Trump's administration has long had ambitions of repealing and replacing Obamacare, though what their replacement is has been the subject of some ambiguity. In general, though, Trump wants to decrease healthcare costs and federal spending, as well as increasing transparency regarding medical costs. He's put an especially large amount of emphasis on that final goal, with his administration releasing an executive order in June of 2019 that outlined a path for the Health and Human Services Department to follow in making hospital-related costs easier for patients to find. The Republican Party has long had a goal of increasing privatisation in healthcare, which they believe would increase competition in the market. This has of course been very unpopular with Democrats, who largely want to decrease privatisation. This came to a head in 2017 when Senate Republicans tried to repeal Obamacare, with their move failing by only 1 vote, that of Senator John McCain. This greatly angered Trump, widening the gap between the two political giants. Despite this difference, many of the goals proposed by Republicans are actually shared by Democrats. After all, it's hard to argue against rules that make it easier to know what you're paying for. It's on the bigger issues, like government-sponsored healthcare and increased Medicare funding, that the two parties really clash. The debate over healthcare policy will likely be a significant argument in the general election, and we'll be sure to look into that debate further as it evolves. In the meantime though, be sure to subscribe to the channel and hit the bell icon to be kept up to date with all of the latest news.